tests, and you've now made the diagnosis and you've shared the news with your patient. What's the next step for them?
Well, there's two parts to follow. One is what's called non-pharmacological and the other pharmacological. I'm going to be simple now. Either you take tablets or you don't take tablets.
Right.
So you may be in a category, like I mentioned earlier, pre-hypertension, and your doctor or physician might say to yourself, listen, you are a low-risk patient and you're still in the early phases, and they would ask you to modify your food, they would ask you to be a little more active, keep your weight down, try and ameliorate your stress levels if that can be done at all at home and at work, and maybe cut down on your alcohol if you're drinking alcohol too much, which I can even expand on if you want. Cigarette smoking obviously has got to come out. So, and that would be what's called non-pharmacological or non-tablet treatment, and you may be put under surveillance for about 6 weeks. That's the international recommendation. And if after 6 weeks of concerted effort about attending all of these things and you still fail, your blood pressure levels are still hovering around 140 over 90, then your doctor would put you on treatment. But I must stress, that's in that scenario, let's just say we're reproducing that scenario, but you've got a strong family history. If you've had a brother that's had a heart attack at the age of 40, or your father that died with cardiovascular disease below the age of 55, then you are a high-risk person. So the teaching these days is that if you have got those high-risk features, and even if you're pre-hypertensive, and if you've got, for instance, an elevated cholesterol level, many physicians around the world will not wait. They will put you onto tablet treatment.
Right.
Because of your risk profile.
And there are obviously different types of tablets, right? I mean, there's beta blockers and
That's right.
ACE inhibitors and so forth. But that's really unique to the patient that you're going to be treating. You know, at the start of the show, I mentioned this latest thing from Pennsylvania State University, where they did this big study now and came out that walnuts with the ALA really helps to lower blood pressure, and it has the added advantage of lowering inflammation in the body, which we know is one of a big cause of some health challenges. What's your take regarding walnuts, omega-3s? If someone is hypertensive, should they be supplementing or looking at changing their nutrition?
The cornerstone of food management of hypertension, the cornerstone has to be sodium intake. Sodium is equivalent to, well, we know it as salt.
Right.
So if you're looking at salt per se, you shouldn't exceed between 6 and 8 grams of table salt per day and the total content of your food per 24 hours.
6 to 8 grams.
6 to 8. We need salt to live. We need salt to live. If you have a very, very low salt diet, you're actually counterproductive. What you do is that you stimulate the system called the sympathetic nervous system, and if you stimulate the sympathetic nervous system, you achieve the exact opposite of what you want to achieve. In other words, you push up blood pressure. So we need salt to live. We need about 6 to 8 grams per 24 hours and no more. I think governments around the world are regulating food to this content. So basically, you've got to cut down on bottled food, canned food, tinned food, processed food, food that are wrapped in plastic, etc. The list goes on there. But coming back, so that's the cornerstone of food management.
Right.
With respect to your question about nuts, that's very true. If you consume food that's high in vegetable, high in grain, high in nuts, you're going to have a diet that's almost sort of consisting of the Mediterranean type of diet, and that's very high in potassium and very high in magnesium, and it's very high in the omega-3 and omega-6, which is also largely found in fish. Now I must stress on one thing here. There's been large scientific studies done on large cohorts of patients that have taken these omega supplements in the tablet or capsule form. And one such study published or released last year, and I happened to be there at that sitting. It was in Munich in Germany. It was conclusively shown that in those patients that take the supplements, it adds no benefit. So now this is a contradictory statement that I'm making to what you said earlier.
Right.
So the lesson there is that take it from the food.
So the organic source. So
the reason is that the ratio in which it comes in the food, the ratio of the omega-3 to omega-6 in the fish, the ratio in the nuts is a correct ratio. And we don't know about the bioavailability in those capsules, the manufacturing process, etc. So this is a very, very, very well-designed study that was done that shows that if you're buying these supplements and taking it from the chemist, you're actually wasting your money. It adds no value.
Well, a few of your colleagues over the years, we're doing this show